Healthcare is a global concern, so while this video will be looking at the USA and other countries like the US, don't think that your country is immune from failings. The reason we'll be looking at America is partially because America is one of the only developed countries without universal healthcare, according to The Atlantic back in 2012, and partly because it has one of the worst systems on earth. I want to explore that today, and in fact in the next few videos. We're going to discuss three main issues that pop up when discussing healthcare. One, being the cost to the consumer. Two, the quality of care to the consumer. And three, the longevity of the system developed. I rarely see this in the news, but it is in actual reality really important when discussing this topic. Cost is something that consistently comes up during election cycles and in the general discourse when it comes to universal healthcare. So let's break it down. Let's look at the median household income in the US, which is $74,300, which is around £56,700 in the UK. This data comes from the Pew Research Centre, and let's compare that to the median household income in the UK, which is £30,800, which is approximately $40,525. This data comes from the Office of National Statistics. Both values are from 2020, so let's look at how much tax we pay on those. Well, in the UK, it's really simple. You take $12,500 from that value, and then you take 20% from the remaining. That's the basic rate, which is a tax band from anything from £12,501 all the way up to £50,000. This works out at being £3,660 in tax. You would also have national insurance to take out of that too, which is taken out at the same time. We'll use tax class A, which covers most people, although it's worth noting that if you have two jobs, you only have to pay one lot of national insurance. So, in class A, you get £183 for free. Yay! So much money! And then the rest is taxed at 12%, since you don't go into another bracket. This means that you pay £3,674.04, which gives you a total taxation of £7,334.04, or an effective tax rate of 23.81%. I started in the UK for a reason. I know the taxes like the back of my hand since I pay them, but we need a complete picture, so let's go to the US. Since we took a single person in the UK, let's do the same in the US. Marriage doesn't really change anything in the UK. You pay like half national insurance if you're a woman who is married, but other than that, there's not very much difference. But back to the US, as I understand it, there's multiple different layers of tax in the US. There's federal tax, state tax, and county tax. We'll look at federal tax. Since this is the people who are going to be dealing with healthcare, it makes sense to only look at federal tax, and that's the only thing that would really change all that much. Same would go for any nation setting up national universal healthcare, though I hope you don't mind me Americanizing here. It is rare to see a developed country not have some form of universal healthcare. So the first tax bracket is $0 all the way up to $9,875, which is taxed at 10%, so $987.50. The next tax bracket is $9,876 all the way up to $40,125. This is taxed at 12%, so $3,630. Then the last tax bracket that we care about is $40,126 all the way up to $85,525, which is $34,475 of our remaining money. This will be taxed at 22%, which will be $7,584.50, for a grand total taxation of $12,202, or an effective tax rate of 16.36%. I'm not going to lie, America, that is a nice tax rate. You make me want to move there. Or you would if that were the end of the story, but it isn't, is it? That's only the effective tax rate for the US if you didn't pay for medical insurance. And the first thing I want to note here is that there are so many different plans and providers that doing research on this is very difficult, but I'm going to try. We'll make it simple by only looking at the metallic plans for now, where the cheaper the metal, the more you pay as a copay, Bronze covers about 60%, silver covers about 70%, gold pays about 80%, and platinum about 90%. This seems reasonable, right? This is where it's going to get a little more difficult to compare apples to apples. As a person in the UK, I would want to say that platinum is the closest fit, since it's 90% of everything, which is probably monetarily the same, or at least close to that we pay in the UK when you factor in that we have to pay a subsidised fee for dental care and also have to pay for optical care. That being said, dental is still subsidised in the UK. It splits itself into 3 different bands. The first band is an exam, a diagnosis, advice, a scale and polish, or an x-ray, which is £22.70. Band 2, all of Band 1 plus fillings, root canals, extractions, at £62.10. And 3, all of the above plus complicated procedures such as crownings, dentures, bridges, and that comes in at £269.30. Each band covers you for 2 months, which I didn't know until I started researching this. You'll typically go in once a year for a Band 1 treatment. Then, on top of that, we have prescriptions, which have a prescription fee, which are a flat rate of £9.50 per prescribed item on the bill. It can be prepaid at £29.65 per month, or £105.90 for the whole year. You also can get bras, wigs, spine supports, and shoes on the NHS at a subsidised rate as well, all of which I doubt American insurance companies would provide. And if you're a veteran, a person under 16 or under 18 in full-time education, or had a child recently, or if the drug is medically exempt, or if you're disabled, or over 60, then you don't have to pay prescriptions at all. Contraception is an example of a medically exempt drug. So, as you can see, we have a lot of coverage, so it's easy to see how it could be claimed that we have platinum coverage. But the cover you should get seems very dependent on your lifestyle and how much risk you're willing to take in your personal life. For example, healthcare.gov says bronze deductibles can be in the thousands of dollars per year. It doesn't cover routine care and is described as a low-cost way to protect yourself from worst-case medical scenarios, something you can't really plan for. So for the sake of completion, we're going to take a single male of age, let's say 23, through a car crash that has left him with a broken leg. A pretty lucky escape in reality, and we're going to take this through 3 different plans: UK, bronze, and platinum. And we're going to see the damage caused financially. We'll say this person has literally only just got cover for the sake of simplicity. The reason I'm picking this extreme case is it's not that unlikely. It's something that you can't really plan for. It's something that can be both your fault and the fault of others, and a broken bone is something that's common in this type of accident. Quick aside for citation number 14 there, it's very telling that this comes from the American Bankruptcy Institute. So, let's crunch some numbers. We'll start with the UK since it's pretty easy. The cost so far is £3,674.04. So after the accident, you'll dial for an ambulance for free. A car accident falls under inpatient care, so your medication is free. Your bones will be set for free, and your meals while you're in the hospital while subpar are also free. Although you can have a takeaway delivered to wards these days. You're going to be kept in overnight for observation just in case you've got a concussion, and then you'll be discharged and booked in for an outpatient procedure to have the cast removed. You might also get an outpatient prescription for painkillers like Cocodamol, and maybe for antibiotics if you haven't finished your course, since a course typically is 6 to 12 weeks for a broken bone if an infection sets in. So you'll have 2 charges of prescription fees there. So £9.15 times by 2, giving you £18.30. For a total cost, assuming no other illnesses that year set in, of £3,692.34, or about $4,858, which seems like a lot. So let's jump across the pond to the United States. Hope you don't mind me generalising here. Care plans change based on the provider, the age of the person, past medical history, if you have a family, how many children this plan's supposed to cover, etc, etc, etc. The NHS just covers you for a flat rate of 12% of your income each year for an average person. It can be higher, and I mean a little higher, or it can be as low as 0%. For the sake of simplicity and for the sake of it all being standardised, we're going to use California rates here. You've had a car accident. You ring for an ambulance, it brings you to the hospital. Provided you have medical insurance, ambulances are typically covered. So now you're in the hospital. This would be an ER visit. Under a platinum plan, you would pay $150. Under bronze, it's whatever the hospital and you negotiate on, and it's 100% of that. While you're there, you're going to need an x-ray. On platinum, that's $40, or whatever the hospital and you negotiate if you're bronze. You're now going to be an inpatient, since they're going to want to keep you in for observation. You've just had a car accident after all. That's going to be $250 a day for up to 5 days if you are in an in-network hospital, or 10% of the negotiated rate if you're not. If you are in a bronze package, that's going to be 100% the negotiated rate. But don't worry, this now counts towards your deductible, even though that could be as high as $6,000, and $500 for your drugs, meaning you would pay up to that, and then after that, your insurance would kick in and pay the rest, and it's 100% of the rest. They're going to want to take bloods to test to see if you've got an infection. That's going to be $20 if you're on platinum, or $40 if you are on bronze. Even if the bloods come back clear, they're probably still going to put you on antibiotics as a preventative care measure. So you're going to pay 100% of what the drug costs on bronze, up to your deductible, or $5 if you are platinum. Again, this is per item, and we are assuming that you're going for generics, because you are always supposed to go for generics. If you don't go for generics, you are wasting money. An RB logo on your ibuprofen doesn't make it any better than the generic version. It just makes you poorer. So, you leave hospital with a script for 12 weeks worth of antibiotics. Let's say it's amoxicillin, that's a pretty common enough drug. And a script for cocodamol as well, or acetaminophen with codeine as it's known in the US. Let's say you're given a box of 35, which is apparently 30 days worth according to Walgreens, which is going to be $19.36. And then for the amoxicillin, according to the FDA, you should have one every 8 to 12 hours, so that works out being about 2 per day. That is 84 days worth, or 168 tablets in total, or $20 at Walgreens, since they define 90 days worth as one capsule per day, and you're going to need 2 lots of this. Then, after that, you're going to have to go back in to have your cast off. This is an outpatient procedure at 100% of the cost if you're on bronze, or $250 if you're platinum, if you're in network, or 10% of the negotiated price if not. This, by the way, is all without saying an orthopedic surgeon isn't a specialist, which they absolutely are, so you would be paying specialist rates on top of that. So, let's do the maths of how much you're out of pocket at the end of this excursion, assuming you have not been injured at all for the rest of the year. For a bronze plan, you're going to be out of pocket $3,990.36. This is for the trip alone. This is not with including your premiums. Under platinum, you're going to be out of pocket $750, which is about what I spend on glasses, for the record. So at the end of the year, assuming this person has had no further incidents, what damage has been done on a bronze package? Well, it's going to be $4,068 for the package itself, bringing the grand total together being $8,058.36. Or £6,124.54. If you're on a platinum care, that's going to cost you $8,784 for the plan itself for the year, and brings us to a total of $9,504, or £7,223.26. You'd be right to say that private healthcare is cheaper, but that's only true if you never get sick. It's also interesting that what I pay for free healthcare is close to the price of the bronze package, the lowest of the metallic packages. We took an incident that isn't all that uncommon. For every 1,000 miles you travel on the road, you have a 1 in 366 chance of having a car accident. So in reality, having health insurance is a necessity, because not having it could bankrupt you at any moment. There are other types of health insurance other than the metallic plans. One is a tax-deductible savings account that can only be used for health insurance, and some even offer dental and optical care. If health insurance is something that is required for you to not live a life as though you're constantly navigating through a minefield, could you imagine having to go through cancer without health insurance? The testing alone could bankrupt you, a fear that you don't really want while you're fighting for your life. Anyway, back to the point at hand. If it's a requirement, let's take it and add it to the yearly tax to see an everyman's effective tax rate in the United States of America. So this person was paying $12,202 originally. If they were on the bronze package, then that would bump it up to being $16,270 for an effective tax rate of 21.81%. Still less than the UK's at 21.81%, but remember what we get for that extra 2% there. And then let's say he was on the platinum package. That would bring his total up to being $20,986 of effective tax, for an effective tax rate of 28.13%. The truth is, America, you're getting a worse deal, and for more money.